Welcome back to the Parkinson's Disease Education Podcast. Is your mouth sometimes as dry as sawdust, making it really difficult to eat and swallow? Maybe even difficult to talk? Or are you afraid to go out in social situations because you're not really sure just how much saliva is going to come out of the corner of your mouth and drip onto your shirt or your napkin or your food plate? Maybe you've experienced both problems where you have dry mouth and too much drooling. Those are just a couple of the topics that we're going to be covering in this episode today. We're also going to be talking about how not taking care of your oral hygiene and your dental health could literally be life-threatening, especially as it pertains to Parkinson's disease. Don't go anywhere. We're going to be talking about all of those things and more on the other side of the intro. And go. Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. Hello, everybody. Welcome back to episode 4 of the Communication Changes in Parkinson's series that Sarah and I are doing together. We are going to be continuing our conversation about swallowing, but this time we're focusing a little bit more on the oral care aspect, but basically the saliva issues that can happen with Parkinson's disease. You can either have dry mouth, you can have too much excessive saliva production, drooling, all those other issues that can happen. And then we're also going to be tying that in with the important subject that we brought up in the previous episode on swallowing, which is aspiration pneumonia. That's a paramount topic for safety in swallowing issues with Parkinson's disease. It's one of the number one things that could literally be life-threatening if you have swallowing problems with Parkinson's disease. So let's take it away, Sarah, and start talking a little bit about, we'll tie back into what we discussed with a little bit of a recap on dry mouth compared to drooling and Parkinson's. Now, both of these can happen, but sometimes they can be standalone issues as well. So why can dry mouth happen? We're just going to kind of recap that based on our previous episode.
So a lot of people seem to look at it as an opposite problem, like dry mouth, not enough saliva, and drooling is too much saliva. But I want to kind of reframe that because that's not typically the case, especially with Parkinson's. I like to think of it more as dry mouth, not enough saliva, and drooling is reduced management of your saliva. Yeah. Because it's not really an excessive hypersalivation in most cases. Mm-hmm. What's usually happening is there is just, like anything with Parkinson's, we talked about this before, Michael, Parkinson's being the disease of low amplitude. It makes everything smaller, less frequent eye blinks. There could also be less frequent saliva swallows. So let's say normally you swallow your saliva 3 times in a minute. Maybe with Parkinson's, you're only swallowing your saliva once or twice a minute. So what happens if you're not swallowing your saliva as regularly? It's going to build up in the mouth. Yeah. Now you add in, your mouth articulators are maybe a little bit less coordinated. They're slower to initiate. And then you also add in potentially the Parkinson's posture where you're kind of hunched over. Well, if you've got excess saliva in your mouth, and then you've got less control, and now you've got gravity in that hunched over posture, it makes sense why the loss of saliva from the mouth or the drooling occurs. Yeah. So that's why it's not uncommon for people to have both dry mouth and drooling, because it's really just, the drooling is really just a loss of control of the saliva.
Right. And that seems counterintuitive, but yeah, it's something that's when it does happen, it's very common to have both issues.
That's right.
Yeah. So thank you for that distinction. That's important to understand. And so I think a lot of people would be in that camp of like, this doesn't make any sense to me. Why am I drooling and I still have dry mouth? Something else too, but one of the things that can be problematic is that sometimes with these drooling problems, I've heard stories of people actually going to get help from a physician, for example, to stop drooling. And they'll prescribe medications that will actually dry you up even more.
That's right. So my caution with people that are struggling with drooling or loss of control of saliva is before you do anything to further dry up the saliva, because remember, it's not really an issue of too much saliva in the first place. It's an issue of not controlling the saliva that you have. And then, of course, if they do Botox injections or the under the tongue atropine drops that are really eye drops that are repurposed to help dry up saliva.
Yeah.
And there can be even, Botox into the salivary glands or systemic medications. The issue is you're with a systemic medication, now you're drying up your entire system, which could result
Yeah.
in dry skin, dry eyes, dry bowels, which
Yep.
can result in constipation. And then with, Botox, now you're drying up your saliva production, which we talked in the last episode, how important saliva is for so many reasons, for speech, for swallowing, for eating, for dental hygiene, all of those things. So I always say, do what you can do to control your saliva before you go that more extreme step of something more severe to dry up your saliva. Now, for some people that have absolutely severe saliva control issues, and that is really the only solution. But I'm always of a start low, go slow when it comes to efforts to dry up the saliva.
I would agree. That's definitely not a conservative route to take, to do medications, injections, and so forth to dry up your saliva. And as we mentioned, saliva issues in themselves affect not only the comfort of eating, but also your speech and your swallowing. So
That's right.
that's a good kickoff point to talk about that, and how basically these issues with saliva, dry mouth, and or sialorrhea or excess, drooling, how that affects comfort, speech, and swallowing.
Yeah. I mean, you take anyone with a dry mouth and it's really hard to articulate words. You
Yeah.
take the excess, not excess saliva, but saliva management issue. It's equally hard when you have a mouthful of saliva. So neither of those states is ideal for speaking. You want the right amount of saliva, the right texture of saliva, because texture matters as well. Thick, tenacious saliva is not very comfortable. You really want kind of that thin, lubricating saliva.
Mm-hmm.
And as far as eating as well, you need a certain amount of saliva in your mouth in order to coat the food and to help break it down chemically. But you don't want excessive drooling to the point where now the food is coming out of your mouth. So it is certainly kind of a fine balance of keeping the mouth hydrated and moist, but being able to manage the saliva that you are producing, and keeping it so that it's not bothersome, or that can be socially embarrassing in situations to have drooling issues during the day.
Absolutely. And not to go backward, but something I've also thought about is that, and we had mentioned this in the previous episode, but certain medications can cause dry mouth. Your carbidopa levodopa can contribute to this, but one of the class of drugs that can really, really affect this is anticholinergics. Some people will take anticholinergics for Parkinson's disease, but there's more than one issue with anticholinergics. Dry mouth is potentially one of them. Of course, that ties in with this episode, but on another topic, anticholinergics can cause more memory problems, actually. So I tend to, that's not very commonly prescribed, but you will still see anticholinergics prescribed sometimes. So you definitely want to avoid those if you can, especially if dry mouth is already an issue. It's going to be even worse.
Yeah.
Anyway, not to go into meds too much, but that was something that, a memory that was triggered when we discussed this today. So, and we tied this in a little, or we're tying this in now. We'd mentioned this in the previous episode a little bit and hinted at the future topic that we're about to discuss now. And that is basically how all of this affects your dental health, oral health. In the previous episode, we had talked about how important saliva is, and of course, hydration is important for this as well. But when you don't have enough saliva and you don't have enough liquid passing through your mouth, you will have more buildup of oral bacteria. Um, Now, we're going to go into why that's really important, not only for your dental health, but for your safety with Parkinson's and swallowing issues. So, Sarah, can you share with us again, for the audience, what is the biggest risk with essentially developing or having more mouth bacteria present, but also developing dental caries and all the other issues that can come along with that? Why does that matter so
Yeah.
much when it comes to swallowing issues and Parkinson's?
So when we talk about aspiration, so things going down the wrong way, what we're really worried about is that it makes its way all the way down to the lungs, and then um, um, worry about, is it going to develop into one of those aspiration type pneumonias? Now, people think about the food and the liquid going down, and that's the culprit for the aspiration pneumonia, but that's actually not the case. The food and the liquid is merely the vehicle that gets the bacteria in the mouth into the lungs. It's the bacteria that's the culprit for developing into that aspiration type pneumonia. So if you are not cleaning your teeth or doing good, diligent oral care on a regular basis, if you have less saliva production, so you're not getting that frequent wash of the bacteria, as you mentioned, off of your teeth and your mouth, and you have more bacteria building up in the mouth, then if you, let's say, take a sip of water, oops, the water goes down the wrong way. Well, it's not the water that's the problem. It's that it washed the bacteria from your mouth into your lungs, which
Yep.
can then make a situation that's ripe to develop into an aspiration pneumonia. So the general rule, and this is absolutely clear in the literature, that the number one way that you can reduce your risk of developing an aspiration pneumonia is to make sure that you are doing really diligent oral care. And it's important to know that the more significant the swallowing issue the person has, the more on top of oral care you need to be. Like if
Yeah.
you are 20 years old with not a medical condition and you didn't brush your teeth for 3 days and you had something go down the wrong way, chances are you're not going to develop an aspiration type pneumonia. But if you have Parkinson's, you're at risk of silent aspiration, you have dry mouth, poor saliva production. If you're less mobile, so you're not getting good air exchange in your lungs because you're not doing your fitness and your cardio activities. If you're dependent on oral care, someone else has to come in and clean your mouth, your dentures. Those are all significant risk factors for developing an aspiration pneumonia. So there's so many things that contribute to increasing the risk, but the number one thing is the bacteria in the mouth. So how diligent are you being about your oral care?
As you mentioned, someone who's really young and healthy doesn't have a lot of medical issues. It's probably not a big issue if it happens one
Yeah.
time. But, basically, the more dry your mouth is, for example, the more bacteria you're going to hold in your mouth.
Yes.
I don't want to repeat what you just said, but basically, I want to emphasize the fact that you're always going to have a normal level of bacteria. There's good bacteria that live in our mouth. They're
That's
supposed
right.
to be there to help break down things, and also as a protection for our immune system. But that normal bacteria should be in our lungs either. But you're going to have an abundance of buildup of bacteria if you're not clearing enough food, if your mouth is drier altogether, you're going to have more accumulation of bacteria than somebody otherwise.
That's
So,
right.
so it's even more important if you have dry mouth and Parkinson's and combine all those things than it would be even under ordinary circumstances. And so, yeah, you're going to have a big buildup of bacteria. And we talked about food staying in the cheek pockets earlier.
Yeah.
And the more fodder, if you will, that bacteria have to grow on, it's going to be even more growth.
That's right.
Because we talked about the saliva helps start to break down sugars. Sugars are one of the things that the mouth bacteria thrive on, which is why you get plaque on your teeth.
Hmm.
And so that plaque on your teeth it sounds gross, but it's bacterial colonies. That's what is forming on your teeth. And that's what you feel, that fuzzy feeling in your mouth. So you just imagine food that's not supposed to be there, staying there, plus the already growing plaque from what you ate. It's
Yeah.
not good. Okay. So I don't want
That's
that in
right.
your lungs.
And I think, just getting into a good oral care routine. So, using a soft bristled toothbrush, using alcohol-free mouthwash. And the reason you want alcohol-free mouthwash is the alcohol version is going to kill the good bacteria too.
Yeah.
So you're more, a little bit safer with the alcohol-free version. Plus, alcohol is drying if you already suffer from dry mouth. Um,
Uh-huh.
but a good one thing that people don't think about is doing some mouth care, even a gargle and a spit or just a quick swish and a spit before you eat. Because if you
Uh-huh.
think about it, we
Interesting.
often think about doing mouth care after we eat, which is important. But
Yeah.
doing it before you eat can be equally important because however much bacteria is in your mouth when you eat, whatever goes down the wrong way is going to carry that bacterial load. So whatever you can do before you eat to make sure that that bacterial load in your mouth has been minimized will go a long way to keeping you safer.
Yeah, one of the best oral rinses that I know of, at least on the U.S. market, and I'm assuming in Europe as well, you could get, at least on Amazon, you could get this, is Biotine, and I
Yeah.
believe that's an alcohol free. So you can get that. By the way, I'm going to leave a link in the description to the Amazon affiliates link for that. There is so in Amazon, you should be able to get that pretty easily. I would think, again, in Europe or in the United States, for sure in the United States. And that's a great product that I've recommended for a long time because, again, it's not necessarily mouthwash, so to speak.
Mhm.
It's an oral rinse and help clear out bacteria from your mouth, potentially something to do before eating.
And also just to lubricate the structures as well. I think that's so important to help moisten your mouth and help, like you say, rid the mouth of that bacteria or clear any food that might be lingering from your previous meal or snack.
Yeah, yeah. Any other oral care advice you would give for this episode today?
If you're just looking for a quick thing to keep on your person, you can always carry a soft toothbrush just in your purse or wallet or bag or whatever. But you can also buy those little sticks with the sponges on them from the pharmacy. So if you know you're prone to pocketing food, you can just discreetly go in the bathroom, moisten the sponge a little bit, and just kind of do a swipe to make sure you're getting along all those little where food likes to stick, all those pockets in between the lips and the gums.
Yeah, that's a great advice, actually. Not something most people would think of at top of mind of like, oh, let me get a little sponge and swipe my
That's
mouth.
right.
Yeah,
Yeah.
that's good.
Can be very handy though when you're out and about.
So before we conclude this episode, Sarah, we want to kind of recap and remind you a little bit about some. I think it would be important to remind the audience a little bit about signs to look out for in terms of either silent aspiration and or the aspiration pneumonia if it is already happening.
Yeah, and I think we talked about this in the last episode a little bit, but if you're noticing an increase in swallowing issues, there's a lot more coughing happening when you're eating, or that wet voice quality, or it's just taking you a lot longer to eat, things aren't going down, smoothly or quickly or well. If you're noticing um, any shortness of breath, chest pain, if you're getting fever, chills, any of those flu-like symptoms, those are all signs and symptoms of a potential aspiration pneumonia. If you're noticing a change in your mucus production, especially if it's kind of thick or yellow or green or foul smelling, that
Mm-hmm.
can be an indication. General fatigue and weakness. The first thing they'll usually check you for if you're, showing some of these signs is either a urinary tract infection or an aspiration pneumonia. And
Yeah.
usually, what they'll do, and I always say, if you suspect that you are developing an aspiration pneumonia, do not pass go, do not hesitate, get yourself to the doctor or to emergency and get assessed because you do not want to wait. It is fairly easily treatable. They'll usually put you on a broad spectrum antibiotic, do a chest x-ray, blood work, and just see if there's something, some kind of pneumonia brewing. But usually prophylactically, they'll put you on some kind of antibiotic just to stay on top of it. But it's not something you want to wait to see if it gets worse. You want to get that looked at and treated as soon as possible.
Yeah, very important because you don't want a rip roaring infection to take off. And then
That's right.
it's not just the base of the lung, it could be an entire lobe of the lung and even beyond. And then of course, infections as they get worse, Well, of course, the lungs, you're going to have your breathing affected by this, but infections, as they get worse, you can become septic, and that can be your entire body riddled with infection, which your organs can shut down. It's a really bad thing to happen. So don't wait. Get it checked out, even if it's a suspicion.
That's right. Err on the side of caution.
Yes, 100%. We talked about aspiration pneumonia a lot in this episode. That's just one of actually potentially many breathing problems that can happen with Parkinson's disease. That's a piece that most people don't think about, is respiratory or breathing problems. In the next episode, we're going to be talking more about breathing problems, because your ability to protect your airway doesn't just depend on swallowing. It also depends on your breathing and your cough reflex as well. So we're going to be going into all things breath support, voice, respiratory training, and all that in the next episode. So don't hold your breath. It might be a couple weeks. So
we'll I see what you did there.
I know. I'm bad about that. So thank you all for being here for this episode. We look forward to seeing you for that. As always, be empowered. Catch you later.